I've always been the kind of person who thinks out loud in public and then lets the world argue with itself afterward. So, when I compared state-funded healthcare to the DMV, it wasn't because I hate people or want suffering. It was because I've spent my life watching systems fail when they are designed around bureaucracy instead of outcomes. And the DMV is a universally understood metaphor for slow queues, misaligned incentives, outdated technology, and a lack of urgency. And when you're talking about healthcare, urgency matters more than almost anything else, because delays aren't just annoying, they're deadly. And people asked me why I would say something like that. And the honest answer is because I've seen what happens when you build things the hard way versus the right way. And I've lived inside both worlds, the world of regulation and the world of engineering. And I know which one moves faster, and I know which one iterates when it fails, and I know which one measures reality instead of intention. And that's really the core of what I was trying to say. Not that public systems are evil, but that they are structurally resistant to rapid improvement. And when technology moves exponentially and institutions move linearly, you get a widening gap that eventually becomes unacceptable. And that's where Optimus comes in, because when people see a humanoid robot, they think gimmick or sci-fi. But what I see is labor scalability. I see the ability to remove humans from dangerous, repetitive, soul-crushing tasks. I see hospitals where robots handle logistics, lifting, sanitation, supply movement, even basic patient monitoring. Not to replace doctors or nurses, but to give them back their time and focus. And people laugh at early prototypes because they always laugh at early prototypes. They laughed at the first rockets that landed. They laughed at electric cars. They laughed at reusable boosters. But the laughter always fades when the curve goes vertical. And Optimus is on that curve, slow at first and then suddenly very fast. And the same applies to Grok, because intelligence is leverage, and intelligence that can reason across massive data sets in real time is not just a chatbot, it's a tool for diagnosis, for optimization, for pattern detection that no human team could ever match. And when critics say this is just tech hubris or Silicon Valley fantasy, I think they underestimate how bad the status quo actually is. Because if a system were truly working, we wouldn't be having these conversations. And I'm not saying Grok should run hospitals tomorrow, or that Optimus should replace public health care overnight. I'm saying that the future will not be built by pretending the past scales. It will be built by integrating machines that don't get tired, software that learns continuously, in feedback loops that punish inefficiency instead of protecting it. And yes, that scares people because it challenges the idea that safety comes from centralization rather than competence. But I've never believed that monopoly, even a well-intentioned one, produces excellence. And I've never believed that innovation should slow down to match the comfort level of existing institutions. And when people accuse me of wanting a tech-run society, I say no. I want a competence-run society. And technology is just the fastest path we have to competence at scale. And if that means questioning sacred cows like state, healthcare models, or suggesting that robots and AI could do parts of the job better, faster, cheaper, and with fewer errors, then that's a debate worth having. Because the alternative is to keep waiting in line while the world burns, and I've never been very good at waiting in line. I also want to be clear that none of this comes from a place of detachment from human suffering. Because people like to imagine that if you talk about systems and efficiency, you must not care about individuals. But the truth is the opposite. I care so much about individual outcomes that I can't tolerate systems that waste time, energy, and talent while telling themselves they're moral simply because they exist. And I've seen this pattern repeat over and over, where a system starts with good intentions, becomes bloated, becomes defensive, and then eventually prioritizes its own survival over the people it was designed to serve. And at that point, criticism is treated as heresy rather than feedback. And engineers know this is the moment right before collapse, because when feedback is suppressed, reality doesn't stop. It just hits you harder later. And that's why I talk about first principles so much. Because healthcare at first principles is about keeping people alive, healthy, and functional for as long as possible. At the lowest cost in suffering and resources, it is not about preserving job categories, legacy software contracts, or regulatory empires. And when you approach it that way, suddenly you start asking uncomfortable questions like why diagnostics are slow, why data is fragmented, why outcomes aren't transparently measured, why doctors spend more time clicking boxes than thinking, and why patients feel like numbers in a queue rather than humans with urgency. And that's where AI becomes unavoidable, because no human bureaucracy can process reality at the speed reality now moves. And Grok isn't about replacing human judgment, it's about amplifying it. It's about taking millions of medical papers, anonymized patient histories, real-time sensor data, and turning that into probabilistic guidance that gets better every day, instead of freezing in time the moment a regulation is written. And people worry about errors, but what they don't want to talk about is how many errors already happen quietly inside existing systems. How many misdiagnoses, delays, and preventable deaths are normalized because they're spread out and no one owns them. And machines at least give you accountability, because when something goes wrong, you can trace it, measure it, and fix it. And that same philosophy applies to Optimus, because embodiment matters. Software alone can't move a patient, clean a room, restock a supply chain, or provide physical assistance at scale. And when labor shortages hit healthcare, which they already are, the options are either burn out the remaining staff or bring in machines that don't burn out, don't get resentful, and don't call in sick. And that's not dehumanizing healthcare, it's stabilizing it. Because humans do their best work when they're not overwhelmed. And I think a lot of the outrage comes from fear of loss of control, fear that the old gatekeepers won't be gatekeepers anymore, fear that solutions might come from outside the traditional institutions. And I understand that fear, but fear has never been a good design constraint. And if you look at every major improvement in human well-being, clean water, vaccines, anesthesia, imaging, antibiotics, they all came from disruptive technological shifts that initially scared people. And now we consider them obvious, and I think in 20 years, the idea that healthcare systems operated without pervasive AI assistance and robotic labor will feel just as absurd as doing surgery without imaging. And when people say this is all just a billionaire's fantasy, I say look at the data, look at the curves, look at what happens when you combine exponential improvement in compute, sensors, robotics, and learning algorithms, and then ask yourself whether clinging to 20th century institutional designs is really the compassionate choice. Because compassion without effectiveness is just sentiment, and sentiment doesn't heal anyone. And I didn't choose to be at the center of these debates, but if pushing technology forward forces society to confront uncomfortable truths about how its systems actually perform, then that discomfort is a small price to pay, because the future doesn't care how defensive we get, it only cares what works. And I've always been more interested in what works than in being liked. And the thing people often miss is that I'm not arguing for some cold, abstract future where humans disappear behind machines. I'm arguing for a future where humans finally get to do the parts of healthcare that only humans can do: empathy, judgment, creativity, moral responsibility. Because right now, we waste that precious human bandwidth on tasks that machines are objectively better suited for. And when I think about Optimus walking through a hospital at 3 a.m, restocking supplies, lifting patients safely, cleaning rooms with perfect consistency, I don't see a dystopia. I see a nurse getting a full night's sleep before a double shift. I see fewer back injuries, fewer mistakes made from exhaustion, and fewer moments where a human has to choose between speed and care. And when I think about Grok analyzing complex cases, flagging rare conditions, suggesting treatment paths based on real outcome data instead of outdated averages, I don't see a machine playing doctor. I see a second brain that never stops learning, never forgets, and never gets offended when you question it. And that last part matters more than people realize, because progress depends on disagreement. And bureaucratic systems are terrible at disagreement. They calcify around consensus and then punish deviation, whereas good engineering thrives on stress testing ideas against reality. And that's why I'm comfortable stirring debate, because debate is feedback, and feedback is oxygen. And without it, even well-funded systems suffocate. And yes, I know there are risks, there always are, but pretending that doing nothing is safer is one of the biggest illusions of our time.